Hi, I'm Dr. Robert Moss with Moss Rehabilitation Center in Springtown, Texas, and I've been helping people get out of pain for over 28 years. And today, I'm going to start with a confession. A few months ago, I reached into the kitchen sink to grab some silverware out of the dishwasher, and as I bent over, my back went out. I know this has never happened to you, right? So, not from a fall, not from a car accident, from a fork. Within hours, I couldn't stand up straight. My wife and kids, well, they had some things to say. And I had to walk myself into my own clinic to get treated. How embarrassing. Now, here's the thing that I thought. I wasn't worried though, because I knew exactly what was happening inside my body, and more importantly, I knew the exact path back. That's what today's video is all about. Whether you're recovering from a fresh injury, coming back from surgery, or just dealing with pain that keeps coming back, I want to give you the same map that I use with my own patients every single day, and the same map that I followed to help recover from my back pain from that stupid fork in the dishwasher. I call it the magical 5 phases of healing, and by the end of this series, you're going to understand your own body in a completely different way. Let's get into it. Before we talk about the phases, I want to explain the word magical. Magical, it's actually an acronym for our core values here at Moss Rehab. It stands for making a difference, attitude, gratitude, integrity, customer and community service, and leadership. These aren't just words on a wall. They're the foundation of everything that we do. Because I believe that how you heal matters just as much as what we do to help you heal. Now, over my 28 years of practice, I've watched thousands of patients go through recovery. And what I found is that almost everyone, young or old, post-surgery or fresh injury, moves through the 5 phases that I'll outline here on this video. Those 5 phases are: Phase 1, minimize pain and inflammation. Phase 2, restore mobility, flexibility, strength, and balance. Phase 3, return to normal functional daily activities. Phase 4 is all about maintenance and injury prevention so that nagging problem doesn't come back. And Phase 5 is performance enhancement, or high performance health as I like to call it. So in this video, we're going to cover the first 2, phases 1 and 2. These are the ones that most people, they either rush through or stop at. And both mistakes can cost you months of progress. Phase 1 is the one everyone knows they're in because it hurts. So this is where most people start, and honestly, where most people stop. They get out of pain, they feel better, and they think they're done. We'll talk more about that mistake in Phase 2 of this series. But for now, let's talk about Phase 1 and actually what it looks like and what works. So at home, in the first 48 to 72 hours after an injury or a flare-up, ice is going to be your best friend. It helps to reduce inflammation and naturally numbs the pain. After that window, you want to switch to gentle heat and start doing some easy, gentle movements as well. Not pushing through the pain, just keeping the joints and the muscles from getting stiff and locked up. A lot of people ask, should I rest completely? And the answer is almost always no. So complete rest actually slows healing. What you want to do is you want gentle movement to keep the circulation going. Okay? Keeps the muscles engaged, and it sends signals to your body that you're actually safe. Now, what do we do in the clinic during Phase 1? We have several tools in the toolbox. We can use electrical stimulation. We can use therapeutic ultrasound. We can use therapeutic dry needling. And one of the most powerful tools that we currently have is our light force deep tissue laser therapy. When my back went out, I drove to the clinic, got on the laser, and by Monday morning, I was 75% better. Within 1 week, I was back to 95%. Now, this is not typical for someone my age dealing with acute low back pain without proper treatment. That was Phase 1 done right. The goal of Phase 2 is simple. We want to get you out of pain, get the inflammation down so your body can actually start to heal. Pain is a signal, and once we address it, then we can get to work. Here's where things start to get really interesting though, and where I see people make a big mistake that haunts them for years. As your pain starts to go down in Phase 1, Phase 2 begins to overlap. You don't have to be completely pain-free to start Phase 2. In fact, waiting until you are is usually a big mistake. Phase 2 is about gently restoring your range of motion, your flexibility, and beginning to re-engage those muscles that went offline during the injury. Here's an analogy I love. So imagine that your car tires are worn out because your alignment is bad. You go in, you replace the tires, but you don't fix the alignment. Guess what? You're just going to continue to wear out those brand new tires because you didn't fix the underlying problem. That's what happens when we stop at phase 1. So we get rid of the pain, the worn tires, but we never address the underlying weakness and movement dysfunction that caused the problem in the first place. During an injury, your body is incredibly clever. Okay? It's going to find workarounds, substitutions, we like to call them. It shifts weight. It avoids certain positions. It protects the area. The muscles tighten and spasm. And those compensations become habits until one day the pain comes back and you have no idea why. So phase 2 is where we break that cycle. For my back, once my pain started to ease, I began a series of very gentle spinal mobility exercises and light strengthening movements to get the spine muscles firing again. Nothing dramatic, but intentional. This is the work that most people skip. And it's the work that separates the people who recover once from the people who recover for good. So here's where we are. Phase 1 gets you out of pain. Phase 2 starts to rebuild the foundation, but the journey isn't over yet. In part 2 of the series, I'm going to talk about what happens when people think they're healed, the sneaky patterns that lead to re-injury, and what phases 3 and 4 actually look like in real life. If you want to go deeper right now, we put together a free report called The Magical 5 Phases of Healing. It walks you through the entire framework, and it's the same guide we hand out to our patients in the clinic. The link is in the description below. And if you're sitting there with pain right now, or you've been dealing with something that just keeps coming back, then I want to invite you to come in for a free discovery visit. One of our doctors of physical therapy will sit down with you, check your mobility and strength, and help you design a real recovery plan. No obligation, just clarity. The link for that is in the description as well. And if you found this video helpful, please hit like, share, and make sure you subscribe so you don't miss part 2 when it drops next week. Thanks and have a great day.